Most nursing students fail NCLEX respiratory questions because they confuse delivery methods with assessment parameters, two areas the new Next Generation NCLEX tests relentlessly. In a real-world hospital, you'll often rely on a respiratory therapist to manage these treatments. But in the testing environment, you are on an island. You're solely responsible for every decision to give or hold a medication. Passing the exam requires moving past simply memorizing drug names. You have to master exactly how, when, and why to deliver respiratory interventions based on your own baseline assessments. Let's break down the rules. As shown in this lung diagram, respiratory drugs fall into two main teams, BAM and SLAM. BAM medications are your bronchodilators. They actively open constricted airways. SLAM medications are your anti-inflammatories, which soothe swollen tissue. Let's focus on the BAM side. Albuterol is your primary rapid rescue bronchodilator, a beta-2 agonist. Because it stimulates the sympathetic nervous system, it comes with expected side effects we call the 3 Ts. First, you will see tachycardia. Second, they will experience tremors. And third, tossing and turning. But there is a strict clinical judgment threshold here. Mild tachycardia is expected. However, if your baseline assessment reveals a heart rate over 120 beats per minute, you must hold the medication and notify the provider. Memorizing a list of side effects won't help if you don't apply clinical judgment. You have to assess cardiovascular vitals first, or you risk triggering a cardiac emergency while trying to perform a respiratory rescue. Now let's look at delivery devices. The metered dose inhaler, or MDI, is common, but it requires precise hand-breath coordination. As you can see in this graphic, poor technique causes the majority of the medication to hit the back of the throat rather than traveling down into the lower respiratory tract. This is why attaching a spacer is critical. This device suspends the medication inside a clear chamber, allowing the patient to inhale the dose effectively at their own pace without needing perfect timing. But sometimes a spacer isn't enough. If your patient is in severe respiratory distress, has cognitive impairment, or lacks hand-breath coordination, upgrade them to a nebulizer. This provides a continuous flow of aerosolized medication, completely removing the need for active coordination. Matching the delivery device to a patient's cognitive and physical status is a core indicator of clinical judgment, a high-yield testing point for the NCLEX. Here is a classic NCLEX scenario. The provider simultaneously orders a rescue bronchodilator, albuterol, and an inhaled corticosteroid, fluticasone. Looking at these orders, which do you administer first? Pause the video for a second and lock in your answer. You must administer the bronchodilator first. Step 1 is forcing the airway open. Then you wait exactly 5 minutes. Only after that airway is clear do you deliver step 2, the inhaled steroid. For an acute asthma attack, you can memorize this exact sequence using the AIM acronym. Albuterol is given first to rescue. Ipratropium is second to sustain opening, and methylprednisolone last to treat swelling. The physical reasoning here is simple. If you reverse the order, the steroid is useless. A constricted airway acts as a physical wall, completely blocking the anti-inflammatory medication from ever reaching the lower lungs. Once the medications are delivered, you have to complete the nursing process with proper patient education. Anyone using an inhaled corticosteroid must rinse their mouth with water afterward. This washes away residual steroid particles and prevents oral thrush. Equipment hygiene is just as critical. Teach patients to clean their spacers and nebulizers with warm, soapy water to prevent bacterial buildup and secondary infections. Let's recap your NCLEX rules. BAM before SLAM. MDIs require spacers. Upgrade to nebulizers for severe distress. Hold bronchodilators if the heart rate exceeds 120, and always rinse after steroids. These clinical judgment steps are the exact tools you will use to protect your patients and secure your license while conquering the NGN NCLEX. Hey, thanks for watching my YouTube channel. Don't forget to like and subscribe and leave a comment. Let me know what topics you want to see more of and how I can help you become the super nurse you were born to be. I hope to see you here again real soon.